Well, the opioid epidemic it's on so many levels, it's heartbreaking. I first started to see the impact of it when I was practicing medicine up in Boston and realizing that more and more patients were coming in struggling with addiction to opioids, and realizing that as doctors we had not been well trained in how to think about pain, how to address pain, and how to address addiction, save for addiction medicine specialists who are too few in number. But the tragedy of opioids also is that it's revealing something deeper that we are dealing with, which is not just a problem with prescribing, but as I came to see in communities all across the country, there's a deeper pain that people are experiencing, a deeper despair in their lives that is often being fed or temporarily assuaged by not just opioids, but by alcohol and by other substances that can easily be misused. And so if we ultimately want to address the opioid epidemic, we do need to change prescribing practices. We do need to expand access to treatment. We do need to get naloxone in the hands of not just first responders, but family members. But we also need to think more deeply about the root causes of addiction. Addiction in many ways is as much a social disease as it is a biological disease. And what I mean by that is that while addiction impacts us on a biological level, affecting our prefrontal cortex, affecting our extended amygdala, affecting our basal ganglia, all areas which are related to our ability to deal with stress and rewards and to control decisions and such. While all of that is true, we also are increasingly realizing that the social context of our lives, whether we are fulfilled, whether we have meaning, whether we have social connection with others, also plays a role in our experience of and our likelihood of developing addiction. So I think that we have to really understand this in order to build a comprehensive strategy. I think where we are now is in a place where overdose deaths are still not decreasing. So we have a lot of reason to worry, but that does not mean that we are not making progress. So we are, for example, reducing prescriptions of opioids, which is important. We, in fact, have seen a near 25% reduction from the peak of opioid prescribing. It's still far above where it was in 1999, so we have a ways to go. Where we're also seeing progress is in extending medication-assisted treatment, which is evidence-based treatment with methadone, buprenorphine, naltrexone, extending that to people who actually need it. There's still far too many people who need treatment and can't get it, held back in part not just by funding, but also by a terrible stigma around medication-assisted treatment. But in places like Rhode Island, for example, we are seeing that the state has now moved to make medication-assisted treatment available in the prison system. And what that has allowed is for more people who need treatment to get it, and a reduction in overdose deaths by nearly 12% statewide in Rhode Island in just a year's time. We're also seeing in cities like Baltimore and others where naloxone is made readily available to first responders and to the public, that overdose deaths, in fact, or the people have been able to save a growing number of lives with the use of naloxone. And so I think there is reason to be hopeful. Some of these strategies are working, but here are a couple of things I think we have to do if we really want to accelerate this movement. Number one is we have to invest in these upstream prevention programs. By upstream prevention, what do I mean? I don't mean just changing prescribing. I don't mean just patient education about opioids. I mean investing in the many programs that we wrote about in Chapter 3 of the Surgeon General's report on alcohol, drugs, and health, programs which are often school and community-based, which are relatively inexpensive to administer, but which can have a dramatic impact on drug use among children, adolescents, and among adults. Some of these programs, like the Good Behavior Games program, for example, for every $1 you invest in it, you see a $64 reduction in healthcare costs, criminal justice costs, and lost economic productivity. There are other programs like that too, the Life Skills Program, the Nurse-Family Partnership. But we have invested so little in those programs despite how much they can return. And I think part of the reason we've done that is partly not enough people know about them in terms of policymakers, but there's also a mentality that we want to see invest in something today that's going to have a result tomorrow. But we need to play both the short and the long game when it comes to opioids, and that means investing upfront. But the last thing I'll say on this in terms of what we have to do is that we also need to think about what's the appropriate role that each of us has to play here. This is not a problem, opioids, that the government is going to solve on its own. We need people in the private sector, individuals and communities to help step up and help us shift the culture around addiction, which still tells us that this is a disease entirely of choice, that this is evidence of a character flaw or a moral failing. And that is not the case. You know, addiction is a disease of the brain. It's a social disease as well that many of us could be a victim to and may already be victim to. And it's really often just dependent on the circumstances in which we live. So we have to remember that we each have the power to change culture when it comes to addiction. And if we can change culture, then we can change a lot of other things. We can make it easier for communities to accept medication-assisted treatment facilities. We can increase the pressure on elected leaders to invest in expanding treatment for the opioid epidemic. But this is what we have to do. And government, the role that the federal government, I think, can and needs to play now, is a role in setting a clear vision and benchmark of where we need to go on opioids. How much, for example, are we trying to reduce opioid overdose deaths in the next 1 year or 5 years? I don't think that has been stated clearly. How are we holding states and the federal government accountable also for doing the work that needs to be done on opioids, not just for passing bills, but responsible for changing outcomes. You know, I care less about a bill that's passed, I care more about an outcome that's achieved. And we might say that the bill is the method to achieving the outcome, but that's a possibility. It doesn't mean it's going to happen unless we hold our elected leaders accountable to those outcomes. So this is a place where I think government has a unique role to play. There's no private company that can set up and set a goal for the United States in terms of how much we should be reducing opioid overdose deaths in the next 5 years or 10 years. That is a place where I think the government has to step up. So yeah, so I was really privileged to work on this issue though when I was in office, because I do think that at the root of the opioid epidemic are deeper questions that we have to ask about society. What kind of society do we want to live in? Do we want to live in a society where we believe every life truly matters? Do we want to live in a society where we all chip in, recognizing that we are vulnerable in some way, whether it's to addiction or loneliness or other conditions, and that we are stronger when we come together, when we recognize our interdependence, and when we help each other? That's what, as tragic as the opioid epidemic is, if it can move us in a direction of shared understanding about our interdependence, if it can help us address these deeper social roots of disease, then I believe that we will have used it ultimately to improve ourselves, to become stronger as a country.